Today we're going to go into something very important. I want to say welcome to our audience out there. Today is going to be a topic on autointoxication. Wow, this is a huge topic. Notifications are going out worldwide right now as we are streaming live via the internet. Autointoxication is a serious problem. As people come into our chat rooms, we are going to continue to move forward. But there are major problems with autointoxication. This actually has a lot to do with how we eat, what we breathe in, what's in our intestine. Good morning to Austria. Good morning to our people in the chat room. I want to say howdy to you. But this is a serious issue. We talk a lot about pain, about disc herniations, about forward head posture, and this is one thing we can't miss. If we miss this, we're missing it all, because this is where it all starts. We're looking at the colon, the textbook colon here. This is a normal colon, and you can see here the appendix and how it makes its way up the ascending, goes across the transverse colon, down the descending, out to the rectum area. This is the last part of our, what we call intestine. We have the small intestine that leads into the large intestine, but this is what we're talking about. We're talking about the colon today. There are serious problems when it comes to colon cancer, and a lot of this is linked to nutrition. And we're going to talk about this. This is a real thorough, hello Kuwait, hello Idaho. This is a real thorough topic. So let's move on. Many of you have seen this before, that gut. And you may have this right now. And you're saying, well, how do I lose the weight? I'm losing weight, but my gut won't go away. Well, we can see the difference that many times in that gut, we have feces, we have accumulation of toxins that sit in that gut that just sits there over months and years. And this is a serious issue because this stops the absorption of vitamins and minerals and nutrients. And as it says, this can be a disaster. So we need to make sure our colon is clean, because this is essential to good health. So if you're having that puffy stomach, you may be that perfect candidate of having this particular problem. We look at the problems of autointoxication. This is basically the colon function. The main function is to reabsorb water. It uses 9 liters of water every day in digestive juices. Obviously, as you see here, if it's not enough water absorbed, we could have from diarrhea. Too much water absorbed can be constipation. The bottom line is that this is a topic where many people do not go to the bathroom regularly. And I'm talking about some people go every couple of days. That's not normal. And I'm going to go into some really important things that you can do to excel in this. But while we're on this topic right here, water, water, water. And if you are constipated, that is the number one thing that you are not doing, is you are not hydrating enough. So it's very important. Now let's look at the various intestinal problems here. I mean, this can not only cause ill health throughout our organs, but this leads to diverticulitis, diverticulosis. This can lead to increased pressure, hernias, as well as hemorrhoids. This can affect Crohn's disease, colitis, irritable bowel syndrome, polyps, which are precancerous to these adenoma or these adenocarcinomas. Or you can see them up in the upper right. But diverticulitis is so common today because of impacted intestines, because of lack of regularity, and because of poor diets. So we have a lot to go through, and I really want to go through this quick because I really want you to understand this. We look at this right here. The causes of cancer, the majority of it comes from diet. Yeah, we can get sickness from pollutants, from medicine, from food additives, sun and radiation, even our occupation, stress, and infection. But look at the size of diet. And tobacco is up there as well, because lung cancer is so big. So diet is the key. And I really want to stress this to you, because a lot of the problems that you're having potentially from autoimmune to even chronic pain, is coming from excessive toxins from the gut, which is causing this excessive inflammation. Remember, in our other programs, we've talked about how all links to all diseases stem from one common denominator, and that is inflammation. So it's really, really important you understand that. Now, I'm going to be jumping around. I have a lot to share here, and I don't even have my stuff in order because I'm so excited to get this out to you. So we look at the issues here, and I wanted to go into a few facts. Let's look into colon facts here. I pulled this off. This is from Inner Healings and Associates, and I wanted to recognize them because this is not my piece here. But our colon is as long as we are tall. The diameter of our colon is equal to that of our wrist. For every foot of colon, we can store approximately 5 to 10 pounds of feces. That's a lot. So we could be storing a lot of feces in our colon and not realizing that we're holding all this weight in our body, but sitting in our colon. I'm talking about for months or years. A healthy person has 2 to 3 bowel movements each day, which is kind of unheard of, but that's the way it should be. Not one time every 2 to 3 days. A healthy bowel movement will measure 12 to 18 inches long. The colon reabsorbs fluids 8 to 10 times every 30 minutes. The colon has referred areas that are similar to reflexology points. For example, we can stimulate points, and I should really do my homework and share this with you, but we can stimulate points in our colon to make us go regularly in our hands and our feet. Really powerful stuff. Now, the degree your colon is clean is the degree your bloodstream is clean. So if you understand that you're not going regularly, that means you're having toxic chemicals and toxic waste getting inside your bloodstream, which is circulating through all the organs and tissues of your body. You can't afford to have a sick colon. It's proven. There are so many proven things to poor diet, like colon cancer and so many ailments and autoimmune diseases, that we cannot afford to have a sick colon. Very, really important. So we look at colon diseases here: ulcerative colitis, polyps, diverticulitis, so common. I have so many friends and people I know that have diverticulitis. You can't afford to have that because you need to really cleanse that colon. We talk about cleansing. I'm going to jump around a little bit. Here is a colonic. Now, many people have heard of colonics. I have gotten several colonics in the past. Generally, I didn't want to put someone here, but this is someone that would lay on their side. They use that little instrument. They put it up the anus area, and they pump water way up in the intestine. And when they're done, they sit on the can, and they actually excrete everything out. And people who have not had these colonics, they will need to get a series of them. But you will really see a difference. You will see stuff that comes out of you that you won't even believe. We look at colitis. Very, very common from pollutants. And we look at IBS, irritable bowel syndrome, very common from bad, poor diet. Very, very common. We look at conditions here. We look at the intestine. The intestine right there should always stay clean. We look at colon here. The colon cleansers, you're going to say, how do you keep the colon clean? These are just some different things I just pulled off, and I wanted to share with you. They have fiber, they have psyllium husks, they have bran, they have oats, different things, and they have different formulations that can help keep that colon clean. Here's another colon cleanse. All right, and I'm going to go into a few things. I know what you're already thinking. I'm going to get there with you. Good bacteria. We need good bacteria, good probiotics in our colon. And again, if you are someone who has chronic yeast infections or had problems and you are on antibiotics, you need to make sure you take a good probiotic, and it may be more than just a yogurt. There are probiotics out there that they sell that are refrigerated that have 10, 13, 14, 15 different probiotics, which are really good. One of my favorites are kefir. Kefir is excellent. I think that's an excellent one. So just keep that in mind. Colon cleansing foods, you can come back to this. This will be posted on my channel, but this is really great stuff. You got the flax seeds, the alfalfa, the spirulina, the wheatgrass are so miraculous when it comes to cleansing The wheatgrass just cleanses the odor. If you notice that you have bad breath, or you get up and you don't even like your own breath, or your spouse or your friend or your girlfriend or boyfriend don't like your breath, and you say, wow, how come I have bad breath? It's because of your colon. So eating green, spirulina, eating these wheatgrass, eating the green stuff from the earth will really cleanse you. And you can come back to this. I just wanted to share that. So good bacteria is so important because this is what keeps your immune system strong. So you look at other things. What can you be doing at home? Well, you got the fresh juices. Juicing is powerful. People, I will tell you, juicing is powerful. It will cleanse. You got high enzymes, the minerals, the vitamins, the nutrients. You know, you're looking at, you can't eat 10 carrots, but you can drink 10 carrots. All right, you can start being really creative with the greens and the kales. That's what will kill. That's what cleanses. You need that cleansing. It's really important. Fruits and vegetables. Look how nourishing that looks. You know, I post this because I just want you to get the feeling of what it's like to see good, healthy food. Those are high fibrous foods that cleanses and washes out that intestines to get rid of all those toxins, because that's what's really that's toxifying us, and that's causing a lot of sickness. Yes, we're talking about, Odont talks about soluble fiber and insoluble fiber. Now, don't worry about the grams. Just get the fruits, the vegetables inside you, because you're not going to get the fiber by juicing. You're going to get it, eat it more in a whole. But soluble fiber basically really means that it kind of absorbs with water, with fluids. Insoluble fiber, like your lettuces, don't really become soluble with water or fluids. But you need to make sure you're getting that. Now, Oats Brand. There's so many different types of fibers out there that's really good, but it is good to mix it. We look at the colon before and after. We look at before fiber, after fiber. You see that's all corroded. It's kind of like the pipes sitting inside a dirty, a water line. It's just corroding. You can't afford that. Remember, this is so important. Now, you're saying about juicing. Juicing is not going to wipe out that sludge. That's why you need the fiber. So if you're the kind of person that likes to take an apple and just cut the skin away and eat the inside of the apple, eat the pectin, eat the fiber, eat those the whole grains. You need to sweep this stuff through. You may even want to go into a program where they have, things already you can drink, you can mix up. There's a lot of different things. Now, I just want to mention a few important things. Okay, I like that picture there because it kind of scares you. It kind of says, wow, that's me. We see that all the time. But just a few things I want to mention about chronic intestinal stasis. Chronic intestinal stasis is what you see on the left. That's primarily the intestine is working through the autonomic nervous system. It's not getting the proper neurological stimulation to it, and it's not getting the right peristalsis. The intestine is supposed to go through peristalsis. It's supposed to keep moving like a worm to push out the waste so you can get that waste out. If you're not getting out, you need to make sure that you are drinking lots of fluid. But a few things I want to bring out to you: the kidney, the heart, the lungs, the liver, all interrelated back to the intestine. We look at conditions of autoimmune. They have conditions of rheumatoid arthritis all linked to this. Breast shows degeneration. Cancers within the breast are linked to poor diet. We can get organs that collapse because of the wasting of the muscle fibers. Kidneys can be affected. The pancreas can be affected. There are so many different degenerative problems. And I wanted to bring this out because most of my channel is all about spinal health. But inflammation is directly related to a dirty colon. Inflammation can cause pain and swelling, and you're probably trying to search to say, where is it coming from? And you're missing the underlying picture. So we need to go back to the source, and the source is nutrition. You see, the small intestine, the duodenum in there, will assimilate the nutrients, but when it sits in the colon, that will seep into the bloodstream. Those toxins, they just become eaten up. And we can't afford it because a lot of degenerative processes all come from these degenerative conditions come from a sick colon. So you're asking me right now, number one on the list is water. Apple juice is actually a great another remedy to help colon cleansing. Apple juice, particularly fresh squeezed. Lemon juice is actually great for the digestive system. Even sometimes take a little bit of sea salt, maybe honey, lukewarm water. Drinking that lemon juice and water first thing in the morning. We have a video out on that. Helps increase peristalsis, increases better skin condition, and it can really help get rid of that extra mucus, because when that mucus starts to thicken up in the bowel, that's when you start getting this lack of movement. You start getting this corrosion. Raw vegetable juices, very, very important, particularly those greens that have the chlorophyll in there. Chlorophyll helps remove toxins. It also has a significant amount of vitamins, minerals, amino acids, and enzymes. And if you're gonna juice, don't let that juice sit around for hours. Drink it as soon as you can. Get those enzymes. Those enzymes will help you heal, and they'll help you feel a lot better. Fiber-rich foods. That's what's going to flush and expel this out. This will improve your bowel movements. This will, you're looking at fibers like raspberries and pears and apples, and fresh vegetables like artichokes, peas, and broccoli. You look at the cereals like whole grains, nuts, beans, and seeds. One of my favorite are your psyllium, your chia seeds. They're so good. Yogurt is great because you're getting the probiotic. Very, very important. So let me just get off of this, and let me just go back into a healthy colon. 1 second. And as I finish up here, I'm trying to find my important, I cannot find what I'm looking for, but we'll go ahead and we'll leave that for now. But so we talk about yogurt. It has lots of calcium in there. You got a lot of good cultures in there, the good bacteria, and it's so, so important. I just want to go ahead and say a couple of other quick things that we talk about keeping that colon. We talked about flaxseed. Sea salt is good. There's a lot of things you can mix with sea salt. Aloe vera is extremely good. Ginger is another excellent thing. We talk about ginger. Ginger does miracles. It cleanses, anti-inflammatory, anti-nausea. So I really hope that you people, everyone out there, really got the jut of what we're talking about here, because this is really so, so important. I cannot stress it more than anything, because this is basically your life. This is your health. This is what it's all about. So I really hope that all you guys out there will subscribe. If you haven't, I'd like you to check out my other channels. We have much nutrition. We've really been pushing it. We've been getting lots of people out there talking about, they want to hear a little bit of this, a little bit of this. So I'm trying to be a little creative. I'm trying to touch the very important things, tying it back into our health, because inflammation, again, comes from the gut. And if we want to get rid of pain and we want to feel well, we have to have a clean gut. This will be posted on my channel. I want to say thank you, everyone in the chat room. I really hope that you enjoyed this. This was pretty thorough. We got through it pretty quick. And I really think that this will really help a lot of people out there. So God bless everyone, and have a beautiful day if you are on the other side of the world, and a beautiful night if you are here in the U.S.